Assalamualaikum warahmatullahi wabarakatuh, and hi everyone. We are from Group 2 Forensic Science.
We are going to give a talk about personality disorder, basic knowledge that everyone should know.
Before that, let us introduce ourselves. I am Nur Aina Natasha binti Syamsubahi.
I am Damia Adini binti Abdurrahman.
I am Untitled Sofyan bin Abdul Razak.
I am Damia Irina binti Adnan, and I am Nur Balkis binti Ashab.
Mental health is just as important as physical health. So today, we are diving into a critical yet misunderstood aspect of psychology, personality disorders. Mental health is an essential pillar of our well-being, influencing how we think, feel, and interact with the world. But what happens when personality traits become rigid, deeply ingrained, and interfere with daily life? This is where personality disorders come into play. Let's begin by understanding the foundation. First, mental health is our emotional, psychological, and social well-being. Mental health is the cornerstone of our overall wellness. It affects how we handle stress, relate to others, and make decisions in our daily lives. A healthy mental state allows for emotional resilience, adaptability, and positive interactions with the world around us. However, when mental health worsens, whether due to stress, trauma, or illness, it can significantly impact how a person thinks and behaves, sometimes leading to chronic challenges like personality disorders. Secondly, personality disorders, enduring patterns that deviate from social norms. Personality disorders are long-standing and deeply rooted patterns of thoughts, emotions, and behaviors that differ from societal expectations. Unlike temporary emotional struggles, these conditions persist over time and affect how an individual perceives themselves, others, and their surroundings. Examples include borderline personality disorders, known as BPD, characterized by intense emotional fluctuations and unstable relationships, and antisocial personality disorders, ASPD, where a person exhibits disregard for societal rules and the right of others. Thirdly, the link. Poor mental health can worsen personality disorders. Mental health struggles and personality disorders are deeply interconnected. Poor mental health caused by factors like chronic stress, trauma, and negative environmental influences can intensify existing personality disorders. For instance, anxiety and depression can make emotional instability in borderline personality disorder more severe. Conversely, having a personality disorder can make it harder to maintain stable mental health, creating a cycle where emotional stress fuels dysfunctional behaviors. So, what exactly is a personality disorder? Clinically speaking, it refers to deeply ingrained patterns of behaviors, emotions, and thoughts that deviate from cultural norms and impair daily functioning. The DSM-5 classifies 10 different types of personality disorders, including borderline, antisocial, and obsessive-compulsive personality disorders. These conditions affect aspects of a person's life, from interpersonal relationships to impulse control. Unlike temporary emotional distress, personality disorders are long-term, pervasive patterns. They don't simply come and go. They shape the way an individual perceives the world and interacts with others over the time. Now, let's explore how these disorders develop. As with many mental health conditions, personality disorders result from a mix of genetic and environmental influences. Researchers suggest that around 50% of the risk for personality disorders are inherited, meaning our genes play a significant role in how our personalities develop. But genetics alone don't determine everything. Childhood experiences, especially early trauma, neglect, or unstable caregiving, can shape how a person responds to stress and relationships later in life. A child raised in an unpredictable or harmful environment may develop patterns of thoughts and behavior that persist into adulthood, potentially leading to personality disorders. Then, there's also a neurological component. Brain structure and function differences, particularly in regions regulating emotions and impulse control, can contribute to these conditions. Additionally, cultural and societal influences play a part. Societal expectations, environmental stresses, and personal experience shape how personality traits develop and manifest.
There's three clusters that dividing personality disorders. Cluster A is involving behavior that is perceived as odd or eccentric to others. For example, paranoid personality disorders. People with paranoid personality disorders have a hard time trusting others, and they often think that people are trying to manipulate and lying to them, even if there's no evidence of the incident. Next is schizoid personality disorder. People with schizoid PD are uninterested in others, so they often perceive as a cold and aloof type of person. Lastly is schizotypal personality disorders. They often have an odd way of thinking and speech deliveries, which means that they think in metaphorical way and often over elaborates their point. Cluster B features emotional and dramatic behavior. First is antisocial personality disorders. They are socially irresponsible and often disregard others. They always act without thinking of the consequences and often associate closely with violence. Borderline personality disorders are emotional unstable type of person, and they often have trouble controlling their emotions. Histrionic personality disorders patient often feels the need for others to notice them and reassure that they are significant, and they also have the strong need to be loved. Lastly, narcissistic personality disorders. They are self-grandiose. They have high sense of self-importance, and they often overstate their achievements or talents to gain admiration and attention. Lastly, cluster C, associate with anxiety and fear. First is avoidant personality disorders. People with avoidant PD often avoid social situations and close interpersonal relationship. Next is dependent personality disorders. People with dependent PD project submissiveness, means that they have the excessive need to be taken care of, and they have a deep fear of separation. Also, they lack confidence of their own abilities and also in themselves. Lastly is obsessive compulsive personality disorders, which means that perfectionism and rigidity that makes them hard to relax even if in daily life. Misconceptions: schizoid versus schizotypal. So both relate to relationship. However, schizoid completely detests the thought of forming and maintaining relationship, while schizotypal shows slight discomfort towards relationship. Schizoid shows no psychotic symptoms, while schizotypal may show psychotic symptoms by the way they think and deliver their speech. Schizoid PD does not lead to schizophrenia development. However, with development of schizotypal PD over time might lead to a full-blown schizophrenia that the symptom might occur during adulthood. OCPD versus OCD. OCD associated with unwanted thoughts and repetitive behavior. OCD is an anxiety-driven type of disorder where the patient recognizes its traits, while OCPD is persistent type of personality like perfectionism. And people with OCPD does not think their traits are problematic. For example, you often have these intrusive thoughts to push people off the train. However, you have no gut to do it, so you enter a state of mental reassurance to calm yourself down and not associate with that kind of action. That is OCD. Meanwhile, OCPD is more like when you're reorganizing your workplace and everything needs to be at their place. Everything needs to follow your kind of arrangement. So that is OCPD.
I'm here to explain about the causes and symptoms of personality disorder. Firstly, I will talk about the causes of personality disorder. There are 4 causes that lead to personality disorder. First is biological factor, environmental factor, psychosocial, and lastly lifestyle. First, let me talk about the biological factor. There are 2 points I will explain here. First is genetic. The family study shows that this kind of disorder tend to run in family, especially the disease named as antisocial and borderline personality disorder. Next is twin study. Twin study shows that the monozygotic twins show the higher concordance rate compared to the dizygotic twin. Alright, next is the brain structure and the biological factor. The brain structure, I only explain two structures here. There are amygdala and prefrontal cortex. In amygdala, it's important to process fear and emotion of us, human. Alright. If there's abnormalities occur at this structure, it will causes the borderline and antisocial disorder. Next is prefrontal cortex, the second structure I will explain. It is important for decision making and planning for the event. The structural issue here is commonly found in a person with antisocial disorder. The second cause of personality disorder is environmental factor. There are 2 points also I will explain here, which are trauma and parenting. First is trauma. I will talk about childhood abuse. It's occurs when the parents always abuse the child, whether it's physically, mentally, and sexually. If this always occurs to the person or the children, it will causes the children to have disrupt normal emotion and psychological development. Next is early trauma, which causes the person to have difficulty in trust, emotional regulation, and attachment issue. Next under environmental factor is parenting, the importance of the parents. First is the parents who is always being neglectful. It is like a parents too lazy to treat their child right. It will cause the child to have insecure attachment styles and personality dysfunction. Next is lack of emotional support from parents. This will cause the child to have difficulty in impulse control. And then next is psychosocial, the third factor of the personality disorder I will explain. There are three will happen under the psychosocial. First is bullying, which causes the victim to have the avoidance personality. Also the academic pressure and the grief. Grief is like someone who lost someone they love and they suddenly become avoidant. Lastly is based on their lifestyle. Alright, lifestyle I would explain here is because of their lack of sleep, poor nutrition, and excessive media usage. Right? If they always do this, it will causes them to be love being alone and no other people to disturb them, and causes them to have to be avoid other people, or we call as antisocial. That's all for the causes of personality disorder I explained in this slide. And now I'm going to talk about the symptoms of the personality disorder. There are 4 symptoms I will talk in this video. First is emotional, next cognitive, then behavioral, and lastly physical symptoms. Firstly, I will talk about the emotional symptoms. Alright, under emotional symptoms, I will talk only 3 points. First is prolonged sleep, prolonged sadness, which means a person have feeling sad for a long period of time, but somehow this kind of sadness is much more intense than the normal sadness, and this will cause the person to have problem with their daily functioning. Next is anxiety. Anxiety is the constant feeling of worries, fear, and nervousness. This is all happen without a clear trigger and clear reason, and this would cause the person to have a panic attack. And lastly, it's about irritability, which means the person is easily getting angry or annoyed over small things. Let me take it simply. It's about that person, his mood is easily swing. His mood change easily, so quick and unpredictable. And next, I will explain about the cognitive symptoms. Under cognitive symptoms, I will also talk 3 points though. Here, is about trouble in focusing, especially when the person is trying to focus over something or task. He can't. He cannot do that. For example, during the exam, the people actually answer the question, but somehow for the person with a personality disorder, he will do the other thing instead because he can't concentrate on the question. Next is negative self-talk. For example, the person like to talk bad about himself. For example, they go about he is useless, and then he said that nobody likes him, the work hurts him, and many other negative talk about himself. This may cause him to damage his self-esteem. And lastly is hopelessness. It has always happened to the person who has personality disorder. For example, this person always think that nothing will change or improve something, and he will never try that thing because he know he will never change a thing, or he think that it will never change it. Next is behavioral symptom. I will also talk about 3 points here. First is social withdrawal, when he loves to avoid his friends, his family, or other social activities. Or let me take it simple. This person like to isolate himself from other people or environment because he hate being with other people and love being alone. But somehow help is available, but he deny it. Next is about sudden drop in school or university performance. For example, when a person in our university or school, but previously he was good in academic and always join or participate in any activities. But somehow recently he started to getting bad in his academic and started to lose interest to join the activities. This has happened because he struggles with his mental and emotions. And next is risky behavior. He will do such a risky thing or dangerous act, like he driving fast, speeding, he trying to jump off from the corridor, taking a dangerous substance like drugs and other dangerous things. But for them, this is a way for them to cope with their current situation. And lastly, about their physical symptoms. This is the symptoms I will explain in this video is about their daily routine. I will only explain two, which are about sleep and nutrition. First is about their sleep. They have problem with their sleep. They are struggling. They, they're struggling to sleep, struggle to awake, and lack of sleep. But somehow this is always found in a person who has personality disorder. And next is the change in appetites. Of it is when we see a person who has personality disorder about their appetites, that person started to eat much more or much less, not as usual. Actually, these people can easily gain weight or lose weight. And that's all the symptoms I explained in this video.
Hi, let's move on to the impact of this patient with personality disorder towards their daily life. Okay, so there is 4 common impact, which is they will impact their relationship, workplace, health, and of course their emotional regulation. So the first one of the most noticeable impacts of personality disorder is on relationships. Individuals with personality disorder may struggle with forming and maintaining healthy connection with others because of their emotional instability or difficulty with trust. For example, someone with BPD, which is borderline personality disorder, might experience intense fear of abandonment, leading to overly dependent or erratic behavior. Conversely, an individual with narcissistic personality disorder NPD might have difficulty empathizing with others, which can result in strained or superficial relationship. Okay, the second one, personality disorder can also affect professional advancement. Erratic behavior, difficulty with authority, or an inability to manage stress may lead to job loss or stagnation in career growth. This setback can negatively impact self-esteem and financial stability, and thus creating further stress and challenge. For example, for individuals with avoidant personality disorder and obsessive-compulsive personality disorder may struggle with their social interactions and will lead to conflict with other workers. So this will make their emotion unstable. Right. Alright, next we go to the third one, which is impact on personality disorder. It will impact their emotional regulation. So persons with personality disorder often have difficulty in managing their emotions. For example, individuals with BPD, which is borderline personality disorder, often experience rapid mood swings and intense emotional reactions to seemingly minor events. These emotional highs and lows can make their daily life unpredictable and really exhausting, not only for the individual but also for those around them. And this emotional dysregulation can manifest as anger, sadness, or anxiety, often triggered by their internal struggle. And this inconsistent emotional response may disrupt work, social interactions, or self-care routines, creating a cycle of frustration and guilt. And the fourth one, personality disorder can affect our health. So this effect can extend to physical health, mental health, and overall well-being. Stress from conflict and emotional instability can manifest in physical symptoms such as headache, fatigue, and digestive issues. And chronic stress could also lead to various health issues such as cardiovascular disease, diabetes, or weakens a person's immune system. Additionally, some individuals may turn to unhealthy coping mechanisms such as substance abuse, such as drugs, or self-harm. This is to manage their distress and mask the pain that caused by emotional pain. And if this is not going to be treated, it will also can lead to worse condition like depression and anxiety. Okay, but you don't need to worry. While these personality disorders are complex, various treatment approaches can help individuals to manage their symptoms and improve their quality of life. So there is four common treatment that we can do to a personality disorder patient. So the first one is psychotherapy, or also known as talk therapy. There is three common talk therapy, which is CBT, DBT, and MBT. CBT, which is cognitive behavioral therapy, can help individuals to recognize and change harmful thought patterns so that they will become more positive thinker in the future. And the second one is dialectical behavioral therapy and MBT, mentalization based therapy. These two therapy can more specifically focusing on their emotional regulation. So the second treatment that we can done is medication. However, there is no specific drug for treating personality disorder, but this medication can help to manage or reduce their symptoms. For an example, we have antidepressants, mood stabilizer, and antipsychotics. Antidepressants is used for individuals with depressions or anxiety-related symptoms. The mood stabilizer can help regulate when they are shown extreme emotional fluctuation. And the third one is antipsychotic. This is prescribed for individuals that have a little bit severe symptoms such as paranoid and hallucination. The third one is a patient with personality disorder must have a good support system. So we can have a family therapy and peer support group. By family therapy, we can help their family or loved ones or the person nearest to them to more understanding and support the individual with personality disorder. So by this support, they will become more better in the future because they believe they have somebody in their side. And the second one is peer support group. This will provide a safe space for the individual with personality disorder to share their experience and coping strategies. And the last one is patient with personality disorder can change their lifestyle to a better way. So they can practice mindfulness and meditation. So by meditate themselves, they can help to manage stress and emotional responses. And the second one is healthy routines, which is they can try to do a regular exercise every day or even for quiet sometimes or 2 to 3 times a week and we must have the exercise, and then we need to have this individual with personality disorder need to have a good sleeping schedule and also eat a balanced nutrition. So this regular exercise, sleep schedule, good sleep schedule and balanced nutrition can improve their emotional stability. And the third one is stress management technique, which is they can try doing what they like or their hobby, such as or try stress management techniques like journaling, deep breathing exercise, and relaxation methods. And all of these can help individuals to cope with their daily challenge.
We are almost reaching the end, so for the last part, I'm going to talk about case studies or examples based on our topic today, which is personality disorder. We're going to go through the background of the case study to know a little bit of this, a little bit of that, of what's going on to this person, and then we will dive to the symptoms or characteristics highlighted from the background and what type of personality disorder that they were diagnosed with. First case, we have Mary, 26-year-old African-American woman. She has made 2 suicide attempts, one as a teenager and one recently. She also reported chronic suicidal ideation in which whenever she thinks about suicide as a way out, it gives relief to her. When she is stressed, she often zones out, even in the middle of a conversation or while at work. She states, "I don't know who Mary really is," and describes a long-standing pattern of changing her hobbies and style of clothing depending on who is in her social groups. Sometimes she would think that her partner is the best thing that ever happened to her and buy him lavish gifts. However, at other times, she can't stand him. She would yell or throw things. She was also engaged in sexual activity beforehand with multiple people whom she often did not know. She was diagnosed with borderline personality disorder with the symptoms of anger, concentration difficulties, emotional dysregulation, mood cycles, risky behavior, self-injury, and suicidal thoughts. Second case, a narcissistic personality disorder case which revolved around the relationship of Robert and Sue. They met each other through an online dating site. Robert is from UK, Sue is from Australia. At first, Robert seems charming, easy to talk to, and romantic, but things gradually changed, especially when they start to live together and during their marriage. Robert only cared about himself and took advantage of Sue emotionally and financially. We're going to break down the narcissistic characteristic that Robert showed throughout his relationship with Sue. Firstly, Robert required excessive admiration. It can be seen through Robert's excessive concern about his appearance. He would often ask if his hair was okay, not to forget the fact that he would spend 40 minutes every morning in the bathroom flexing his muscles and long minutes of gazing at himself in the mirror. Secondly, Robert has these things that are more important than they are, talks a lot about their achievements and abilities even if they're not true or not that impressive, and expects others to treat them like they're better than everyone else. He complains a lot about the jobs and furnitures. He did not wish to work the jobs recommended by Sue simply because he felt that the jobs were beneath him when he didn't have many qualifications himself for high-level jobs. Thirdly, he believed he deserved special treatment and expected others to do what he wanted, even when it was not fair or reasonable. He felt entitled to come to Sue's home without contributing any money. He also felt entitled to Sue's exclusive time that he wished to have, like preventing her from meeting her friends. Towards the end of their relationship, he felt entitled as well to Sue's money, as per I left my job at the UK to come to Australia for you, and I should have been paid for my domestic service of occasionally cooking while we were married. Third case, we have Edgar, a 26-year-old man. He has extraordinary intelligence but unable to complete or participate in any educational programs. He thought that other people thought of him as peculiar, odd, and he felt like an outsider. During his childhood, he went to various schools as his parents moved around. He did not participate in the social life, games, or sports with his peers, and he is exceedingly isolated with his computers and remains detached from people. He has never been in a relationship and has no desires to even be in one. So, throughout that background, Edgar was diagnosed with schizoid personality disorder due to his pervasive pattern of detachment from social relationships, his emotional flatness, his lack of desire for relationships, and his preference for solitary activities. Fourth case, Tyrell, who is an unemployed man in his late 30s, was diagnosed with schizotypal personality disorder. So let us see what's going on with him. He complained he had recurrent irrational thoughts, compulsive behavior, and social isolation. Since childhood, he had always been eccentric, withdrawn, and without real friends. He anxiously feared close relationships and was preoccupied with reading stories of Dracula. He didn't share his inner thoughts or feelings with anybody, not even his parents. He never graduated from school but continued to work in factories at night. So, what we can highlight is that schizotypal patients will avoid social interaction because of a deep seated fear that they have of people. Fifth case, Nathan, 36-year-old man who developed severe depression after he was fired from his job. The complaints are that he had disturbing inner feelings of hatred towards other people. Nathan's trouble actually started during his childhood. He was very aggressive towards other children and was involved in recurrent conflicts. At home, he was constantly on guard. While he was working, he also involved in severe interpersonal conflicts, reacting with aggressive attacks at the slightest offense. This case study illustrates Nathan's characteristics that feature paranoid personality disorder. Firstly, we have to know that people diagnosed with paranoid typically do not seek treatment unless they are in crisis or because of additional pathology. In this case study, Tyler was fired from his job and had depression. Secondly, he is suspicious and mistrustful of others. Plus, he is too quick to defend or attack perceived threats to his reputation or character. Sixth case, Gwina, a female in her 30s. She was raised by a single mother, never met her father once. At an early age, she already felt unwanted as her mother described her father as a person who would do anything for anybody, however, just not for her. In her childhood years, her mother would physically and emotionally abuse her. It can be seen simply as she was beaten whenever she made mistakes on homeworks and extracurricular activities. So this ended up with her quitting activities to avoid making more mistakes. Besides that, her mother is a hoarder of personal belongings and they live without functional plumbing. So this situation led her to being bullied at school because she was lack of hygiene. Continued to her 20s, a car accident ruined her chance to leave home and she blamed herself for being hopeful. Then she attended community college on and off, feeling not happy or sad, just on autopilot. In the last few years, she went back to school and secured a degree. Somehow, she is still in the same circle where her roommate is abusive and she never fought back because she felt like she deserved it. After 3 years, she found a job in her field and described it as not because of lack of opportunities, but rather as she feared making the wrong decisions, social and occupational risks, and feared of misplaced hopes. She came to therapy after she found herself crying at her job without any triggers, procrastinating, and struggling to answer invitations to social events from her coworkers. Gwina's condition meets several criteria of avoidant personality disorder, including social inhibition, feelings of inadequacy, hypersensitivity to negative evaluation, impairment of identity, and reluctance to get involved with people. Lastly, I combined the 7 and 8 case under the Obsessive Compulsive Personality Disorder or CPD. The 7 case, we have Mark, 42 years old male. He has been unemployed for some time because he has had this difficulty of maintaining his employment. Recently, he was able to meet production demands at his factory job because he got consumed with making each package perfect before moving on to the next package. On one weekend, when his family planned to visit the grandparents, Mark started packing on Wednesday afternoon but did not finish till the very last minute. His rigidity and extreme attention to detail led to his being diagnosed with OCPD. For the 8th case, we have Ivana Musik, a female that has the need to feel accomplished. It is rare for her to take a day off and not to check something off her list. She was so obsessed with efficiency that she would schedule activities weeks in advance. Her calendar would be so detailed and planned out, and there were no possibilities to deviate from it. She centered her life around work by living close to the office so that her commute would be short and she could maximize her day so that she would have time after work to go to more places faster. The thought of jeopardizing her efficiency would send her into panic. So as we can see throughout those two cases, the characteristics of an OCPD person, he or she has pervasive need for perfectionism that could definitely interfere with the ability to complete tasks and preoccupied with details, orders, and schedules. Other than that, they are excessively devoted to work, obsessed with lists and rules, being rigid and inflexible.
That's all from our sharing session. All of us hope that you guys can gain benefit and new knowledges from this talk and spread more awareness on this particular topic.
Ending this talk, we hope that each of you guys could take a really good care of your own mental health, regardless of any hardships you are currently facing.
Be sure to reach out to your trusted one when things get unbearable. Remember, you are never alone in this world. That's all from us.
Thank